Mustafa Bahadir Sucakli is a public health officer with the World Health Organization in Turkey. He joins me now live from Ankara to talk about the threat the coronavirus poses to those stuck at the borders and in those overcrowded camps. Thanks so much for joining us. You know, knowing that services and resources on all fronts are limited in these areas, how much danger are these populations in of contracting the virus and then spreading it much faster because of their conditions?
Thank you. Good afternoon. Actually, Turkey has made a great achievement starting from 2011 when the refugee rush has come to Turkey, and like any refugee populations, displaced populations have a greater risk for acquiring diseases because of their disturbed conditions, the problematic conditions that they live in. That's why these populations are quite stressed and under risk of diseases.
Right.
But in general, yeah.
Where are you seeing the greatest trouble spots?
The migrant populations and refugees in the borderline might be at risk because of the lack of proper health services conditions in the region. Although in certain regions there are relatively good health services that can reach out to people in many pieces of the North Syria or in the borderline of Turkey with surrounding countries, there might be lack of proper health infrastructure to reach out to those people. Therefore, these people may be at higher risk for not only coronavirus, but also for many infectious and other diseases.
You know, we're seeing thousands of people, though, in wealthy, settled populations around the world unable to get testing. So how much of an effort is there to test migrants and refugees stuck in camps or at borders for the coronavirus?
WHO is working with local governments, not only in Turkey, but also in the other countries to provide services for refugee and migrant populations. And we know that Turkish government is also providing support for North Syria and the Syrian border refugees for testing capacities. And it's quite similar with what's happening in Turkey. So Turkey has a quite good capacity for response to coronavirus disease, which showed up to date actually with tests and the infrastructure. And Turkey proposes the same infrastructure to Syrian refugees in Turkey.
Let me just ask you quickly, though. I mean, what will happen if measures are not taken to protect these populations, as well as the dozens of health workers and NGO workers that have to come in and out of these areas constantly?
This is quite tricky. Actually, those services are provided, especially in North Syria, with the support of local NGOs and local healthcare workers. And like in the all healthcare settings throughout the world, these healthcare workers are also at risk of coronavirus, acquiring coronavirus. And when they get sick, they will not be able to provide services to Syrians. That's the basic gap in the health services. But that's not limited with the crisis areas or the refugees, migrants, but also for any other part of the world.
Okay. I'd like to thank you so much for joining us, Mustafa Bahadir Sucakli there. Thank you for that.